Okay, today we're going to be talking about the Metaneb. Before entering a patient's room, we're going to go ahead and check the patient's chart, make sure that they don't have any contraindications. That would include an untreated pneumothorax, hemoptysis, stenitis, nausea, any facial trauma, intracranial pressures greater than 15, and active TB. So another thing that is a little bit different than the Easy PAP with this is to help with airway, secretion clearance. It is also aerosol delivery and lung expansion as well. So it's a 3-in-1 therapy that we can do. But the difference is we don't really need the patient to be fully alert and oriented. We can go ahead and hook this up to if the patient is on a ventilator. We can hook this up. We can also put a face mask around, or we can use a mouthpiece here. So let me just explain this to you before we go into the patient's room. We'll gather our supplies, go ahead and introduce ourselves. Hi, my name is Kate. I'm with Respiratory. It looks like the doctor today wants you to do some Metaneb therapy. What that's going to do is do some lung expansion, also deliver some aerosol medication that we have for you, and also help with that secretion clearance. It's going to help you cough. It's going to have some vibrations. You're going to feel it's going to loosen up the secretions there, and then hopefully help you cough and get those expectorate those out. So we definitely want to make sure we grabbed all our medications that we need. We can hook it up here in the nebulizer area, and then we'll go ahead and get our Metaneb. Our tubing, go ahead, you'll see a little hole, you'll click it in and then press it down to lock it into place. The on-off switch is on top here. We really need to make sure that our patient keeps a tight seal around the mouthpiece. We have a nose clip if we need to do that, but because it's positive pressure going into the airways, helping those expanding the lungs, we need them to have that tight seal. So you'll see their cheeks kind of puff out a little bit, meaning that they don't have too much of a air leakage. So we'll go ahead. This therapy will take about 8 to 10 minutes, so it's quite a bit, but we'll give you breaks in between. We do, as therapists, need to monitor the pressures here to make sure we're giving them a therapeutic amount of pressure, but also we really need to be monitoring their respiratory rate. It's really easy to hyperventilate using this device. You get lightheaded, dizzy. We make the patients work quite a bit, but we want them to work hard so they can get out of the hospital, but we don't want to push them too far. So we'll start them off after they're secure, have their mouth around this. We'll start them off on the aerosol delivery, and we'll do this for 2.5 minutes. And just to get them started, then we'll click them up to the continuous high flow oscillation. We can do this in 2 different settings here. This is a quicker oscillation. You can feel the flutter in their chest, their cheeks puff out, or this is a slower one. We'll make sure that we'll want to watch this manometer here. They're in between 10 to 20 range, at least for our therapeutic range. And then we'll do that for 2.5 minutes. Then we'll click them back down to the aerosol, give them a break, let them relax. And then we'll click them down to the continuous positive expiratory pressure. Meanwhile, this dial right here will keep them on a low flow, and we're adjusting the flow to coincide with the pressures here. We really want them in a therapeutic range, so we can increase the flow to help pick them up if they're just too low of pressures. So after we do the continuous positive expiratory pressure, we'll do that for 2.5 minutes as well, and then the patient is done. But it will challenge the patient, and I've seen it often when their patients usually have a hard time keeping that tight. That's one of the hardest parts, keeping that tight mouth seal around. So sometimes not an aerosol mask, but an anesthesia mask is the best bet because it creates that tight seal, and the patient doesn't have to keep on taking their mouth off or feeling that. So afterwards, we'll want to go ahead and make sure that we listen to the lung sounds and see if we produced any coughing, see if their work of breathing has decreased at all. And that's about it.